Good afternoon. It's Wednesday, May 22nd. And this is Dr. Scanterbury here from Dialysis Patient Citizens Educational Center, coming to you live to talk to you today about kidney transplant, dialysis, how you can stay healthy. And as summer is approaching, as we know, Memorial Day is on us. We want to know how can we eat healthy. So again, this is Dr. Scanterbury. It's 12:31 here in Delaware, and I am coming to you live. I'm trying to adjust my camera so you see more of me and less of the wall. And thank you guys for joining. Welcome, Nancy, and welcome, Ms. Wright. Thank you for coming on. And joining me here at Dialysis Patient Citizens Educational Center. We are here to talk with you about anything on your mind. It's, whether it's treatment options, early intervention, staying up to date with your vaccinations, getting on transplant lists, and staying healthy. We also want to talk about mental health because we know that that's also just as important. We want to stay healthy, but we also want to be able to seek help if we are suffering from depression, if we're suffering from anxiety. And it's one of those things that I know that a lot of us don't want to talk about. We don't want to talk about the existence of mental health disorders. It's a stigma in many communities, and I know it certainly is within the Black community. When we talk about depression, when we talk about mental illness, these things are common, and we know that at least a quarter of the population suffer from mental health disorders. So whether you are on dialysis, whether you're on transplant, a lot of it is dealing with your situation. You may have issues with family, you may have issues at home, and just being on dialysis itself, having a chronic disease, which is whether it's heart disease, whether it's diabetes, whether it's living with conditions that you are unsure as to what your outcome is. It's okay to be depressed. There are reasons why, and sometimes there's no reason why, but understand that you can find help, and we can get you through whatever it is you're facing. So mental health and chronic disease is always a challenge in maintaining that healthy outlook. And so we can talk about just in terms of depression that comes from being on the list too long. You're waiting years and years for transplant, or you have been called and it's never your turn because you're not quite there yet. And so understanding that there may be barriers, it may take a long time, but the goal is really about how can you stay healthy? How can you do the kind of things that will keep you in good shape while you're waiting? And even after, even if you're on dialysis and you're not waiting for a transplant, you want to maximize your time, and you want to be able to say, what can I do to live as long as I possibly can, doing the kind of things that I can do to get there. So you want to be able to say, how do I stay healthy? And certainly, if you're not, have not joined or went on to the DPC Educational Center website, I want you to do so, because when you go to DPC Educational Center, Google that and go on the website, you can get lots of information on there. You want to be part of the community. You want to be able to join in not only here on Instagram or Facebook, but you want to be able to use the resources that they have in terms of whether it's a dietitian, whether they're talking about nutrition and also how to keep your phosphorus down, and also great recipes for chronic kidney disease and people on dialysis. So that we know there's certain things, and these recipes are overseen and written by nutritionists, so they know what's okay for you to take in and what's not okay. So they're definitely want to make sure they're low in phosphorus and If you're watching your potassium, the recommendations are generally things that would keep those things down. So go ahead, especially as we are coming to the end of May and we are in coming to Memorial Day weekend, that we know we'll be outside and looking for those recipes that you can enjoy with you and your family. So again, thank you for joining. Tell your friends. It's 12:36 and I'm Dr. Scanterbury, and this has been a rescheduled time for Instagram. So many of you may not be aware, but if you just ping your friends and have them come on, we're here to talk all about whatever it is you want to talk about. So post your questions and let's dive in. So thank you for joining, those of you who are on already. And again, we are definitely here to discuss. And so what I started talking about was mental health. And we want to know that we all experience different kind of stresses, whether it's stress with life in general, whether it has to do with work, whether it has to do with health. And so it's not, don't see yourself as being outside the norm. I mean, certainly we all have to deal with some kind of stress, and some of that stress can get us down. And while I'm not a psychiatrist, I know that I suffer from depression. And despite all that I have and all that I do, there are times where we feel like things are still not going right for us. And so I deal with trying to focus on gratitude. And yes, there are things may not be going my way, but I know there's so much else that I have to be grateful for. And so you want to talk to your healthcare professional, whether it's on dialysis, whether it's your transplant team, to get some help. And I know certainly when I see my kidney transplant patients, when I see my patients who are on dialysis, it's okay. And you may need some medication, you may need some therapy, but that's what we're here for, to understand what you're dealing with. How can we get you to a place where you're doing much better? And so sometimes we feel down, and for adults it may be prolonged depression or irritability. You may be, and certainly for some of our patients I know who sometimes post-transplant are on steroids, they can have these ups and downs. They may find themselves crying and tearful, excessive fears, worrying, and not wanting to participate socially. You just sort of withdrawn. And so whether it can be eating habits, sleeping habits, feeling angry, and even suicidal thoughts. So you want to really recognize, do I need help? How can I get help? Reach out to someone, because we don't want for you to be so depressed that you don't want to do anything. You don't want to go to treatment. You don't want to take your meds. So this is a stigma in, like I said earlier, in many communities. So I just want to bring it to light. And so you can, whether it's family, whether it's friends, sometimes we don't want to tell our loved ones what we're facing because we feel, well, they won't understand. And so you want to seek professional help. You want to definitely say, maybe I need a therapist. And I often will tell my patients, think about it. Seeing a therapist doesn't mean you're crazy. Seeing a therapist doesn't put you in a box with a specific diagnosis. It just gets you the help that you need. And oftentimes you may even need medication. So that's one topic I wanted to talk about today. So if any of you have questions, any of you have any thoughts, remember, I am just lending my way of treatment, which may not necessarily be for everyone. But certainly we are coming up on this holiday, Memorial Day weekend. We're all excited. I know for many of you, the weather's getting better. Here in Delaware, we finally got rid of the rainy season, hopefully for a couple of days. It has been like every day for almost weeks, it seems like. But now we've got some sunshine. It's very green from all the rain. For many of you, it may be allergies. A lot of my patients are still dealing with significant allergies and congestion. So if you're needing to take that Zyrtec or any kind of antihistamine, you may have to reach out to your doctor from that standpoint. But as you get outside, make sure you're able to, if you're in the sun, make sure you take your sunscreen, sun protection. to reduce your risk from getting sunburn or skin cancer. That's important. And for many of my patients, I want to make sure that they're at least seeing a dermatologist once a year, because I know that there's always that increased risk, especially if you think about transplantation. That is going to be one of the things that we look for in terms of post-transplant, is sending our patients to the dermatologist to make sure that there's no risk of skin cancer, especially with immunosuppression. So thank you all for joining. We want to see if you have any comments, any questions. Let me know what you want to talk about. Certainly for those of you who are not on a social media, not on social media, internet, be sure to join. Go on Google Dialysis Patient Citizens Educational Center so you can gain more information. There are many different topics about more on kidney disease, what causes kidney disease. There is staying healthy, as I talked about, improving your quality of life. You want to make sure that you're doing your physical health, managing your stress. We talked about stress earlier, and so you want to be able to find ways that can help you manage your stress, whether it's just getting outside. I know the sun, being in warmer weather or just being outside can really lift your spirits. It really can cause you to have that rush of endorphins. So you want to do, whether it's gardening, whether it's just taking a walk, whether it's sitting by the creek and watching the ducks, or fishing, anything that you can do, listening to music, dancing. Those are things that are ways that you can get out of the low that you're in and learn and more about how you can manage your stress. So certainly there's lots on the website that will allow you to gain more insight. And as I said earlier, there are lots of recipes when it thinks about staying healthy. There are ways to stay healthy, dealing, coping, and also learning how to eat better, how to keep your phosphorus down, how to keep your potassium down. And as we come into the spring, there's lots of fruits out there. Knowing which fruits are good, which ones are going to give you too much water volume. If you're thirsty and you're not making urine and you're on dialysis, how do you enjoy those things without gaining too much fluid weight? Learning ways to perhaps, decrease freezing your grapes and using them in small quantity so you can quench your thirst, have that nice cool feeling, but still be able to enjoy your fruits and know which ones will not elevate your potassium or your phosphorus and still allow you to enjoy some very good summer fruits. So if there's any questions you have, we're already at 12:43, and I certainly have been doing all the talking. Let me know what you want to discuss. Certainly, my expertise is more on the transplant side. A lot of patients. One of the things that I was discussing with a recent new patient is the ability to know that if you're waiting longer in one area, you can multi-list. You can get your name on other transplant lists as long as they're not within the same catchment area. So you can, let's say you live in a cross-sectional area, like right now I'm in sort of close to the tri-state area, but Delaware and Philadelphia pretty much compete for the same kidney region. So for patients who may live here in Delaware, they may be able to get on a list outside, which may be Baltimore, which may not be very far, may still be an hour plus compared to going to Philadelphia, but it's a different area. So as long as you're willing to travel to that area, you can multi-list. For people who want to go a little further, they can go into New Jersey area from that standpoint, or even New York. But you don't want to go to an area where there are many more patients listed than your current region. So for patients in New York, where there are many more patients and the waiting list is longer, like beyond 10 years or so, they would travel outside of New York to New Jersey or even here to Delaware to be listed under a separate region, knowing that if they were called for a transplant, they would have to be able to travel that 2 hours or 2.5 hours, whatever it may be. But for many transplant centers, when we are aware that there's a transplant potential donor and a kidney's available, and whoever's number, that those first 5 patients are notified. So if they're not at home or they're far away and we know there's a potential, we will let them know that you may need to travel that distance to be able to get that transplant if and when your turn comes. So understanding that you can multi-list at different areas is important if you're waiting a long time, or if you're competing with a few thousand people within your own area and you find that your waiting time is longer, and you have one of the very common blood types like O or A. Blood type O, because that's the most dominant blood type, they wait longer than everyone else. And so there's blood type A right beyond. Blood type AB and B, they're a shorter list. So for those patients who are that blood type, they may not necessarily have an issue in getting transplanted within their region. So those are things that you will want to consider down the line. So let me know what you want to talk about. I hope you're hearing me, or am I rambling on? Certainly, I see you're here, and I want to know what we can discuss. So thank you all for joining. I see some new people. Nancy is generally the first one on. Do you have any questions, Nancy, to pose to me? Let me know what topics you want to talk about. One of the things that's for patients who are on the list, and realizing that one of the things that you may not realize is that for people listed for kidney transplant, oftentimes if they may think they're getting a transplant, or they may be notified, but if that organ that's being removed, if let's say there's a heart recipient, and that heart recipient needs a kidney, that kidney will go to the heart recipient. And if there's a liver recipient that needs a kidney from the same donor, that liver recipient will get one of those kidneys. So sometimes you may have a potential to receive a kidney transplant, and it doesn't come to you because there are 2 recipients ahead of you who need double organs, and those double organs could either be a liver, a pancreas, or a heart transplant, or even a lung transplant. And those recipients with those organs get preferential treatment to get those organs ahead of time. So those are things to realize also as you wait and feel like you're missing out on getting transplanted. So if there's anything else you would like for me to talk about, I'm going to go to the DPC website and just sort of scan some topics. Just think about, for instance, advocacy. One of the things that we discuss here a lot is advocacy. Advocating for others. Even in my clinic, even in terms of getting good health, you want to make sure that as you see your doctors, make sure you're also taking care of your general health despite being on dialysis, despite having a transplant. Remember, your transplant professionals and your nephrologists are not your primary care doctor. So if you don't have a primary care, make sure you get a primary care physician. That primary care physician is going to be the person who's going to link all your care and the things that you need to get done. So you may be seeing a heart specialist, you may be seeing a pulmonologist, but the person who is going to direct you to make sure you're up to date on all your cancer screenings, who's going to link those messages from your cardiologist, who make sure you're on the right medications, who also, let's say, for instance, you're post-transplant, but you still have problems with your blood pressure, you're seeing the nephrologist, but you develop other issues, peripheral vascular disease, neuropathy, things that they may need new medications for. Your annual physical, making sure that you get your eye exam, that you're reminded of all the things that you need to get done to stay healthy. That colonoscopy that we all dread every 10 years or every 5 years if you have polyps, knowing that those are things that your primary is the ones responsible for. And I know that on transplant that was a big issue for many of our patients. Oh, I'm coming to see, I have so many doctors to see already. I'm seeing this doctor, but you need a primary. You need a primary physician to make sure that all your, if you, let's say you have a biopsy and it comes back with something concerning, making sure that you get to the right person to take care of that, making sure you get that echocardiogram, making sure you see the podiatrist for issues that may be going on with your feet. So it's very, very important to find a good primary care, and also to make sure that you and your doctor have a good relationship and that you are able to be heard. You want for them to be able to involve you in your care. You want for them to be able to discuss things with you. You don't and engage in a conversation, not just tell you things, but you want to be able to have that discussion. You want to be able to feel comfortable with your primary care physician, so that are your general practitioner, or the health professional who you're seeing, whether it's a nurse practitioner or a PA. You want to be able to have that conversation and make sure that you're on the right meds, making sure there's no interaction with those medications. So certainly it's that is very important, whether you're on dialysis or whether you're having a transplant, whether you just have chronic kidney disease and you're seeing a specialist. That primary care person is the one who's going to link all your issues together and to see you as a whole person, as opposed to different compartments or different specialists. And when the specialist has a question, they can reach out to your primary to make a request that you follow through on whatever those recommendations may be. So that's actually very crucial. And so it also adds into whether in linking or bringing together your physical health and your mental health. They can be the ones to help you get the appropriate recommendations for a therapist, professional treatment. Let's say you have back issues despite being on dialysis. You may want to make sure you get the bone scan. You may need need physical therapy. Your primary the ones who will send you there, whether you need to see a chiropractor for certain things, and also refer you for different things that may arise, such as any abnormal skin disorders that you may have. So thank you for joining. Again, I'm Dr. Scanterbury. I am the medical consultant for Dialysis Patient Educational Center, and I work with Nancy Scott to bring you these sessions, and I hope that they have been helpful. Thank you all who have come on and have joined. And if you have any questions, please let me know. Remember that there are also ongoing sessions. If you go to DPC website, you will be able to see different resources, different news and events that are usually posted on there. So you can look for these events that are coming up, whether they are nutritional sessions, whether they are live videos, not only on Instagram, but you also have some nutritionists and other sessions. I think next month we're having a session on Instagram that will talk about different topics, whether we have one on June 5th, and then we're also going to talk about phosphorus later on that month. So certainly you can sign up for the newsletter. There's a lot of good information and different testimonials that you'll find in the newsletter from patients who have experienced and gone through their dialysis, kidney disease, got transplanted, and understanding more about what other people experience. Because you need to realize you're not alone in your journey. There are thousands of other people who have traveled this road and may be able to help you in your journey. And so that's what's also important, that you know that you don't want to be suffering alone. We want to raise awareness. You want to have other people advocate for you. You can talk to your family members so that they can understand how to be better advocates for you, and you can be better advocates for yourself. So I encourage you to go to the website and just peruse the wealth of information that is on the website, and also sign up for the Kidney Citizens magazine. This is generally takes a lot of effort to pull those articles together, and there's also an email newsletter that can go out to you. So please go ahead and sign on. And I thank you all for joining today. I hope have not had any questions from the audience. I hope that you're hearing me okay. I'm trying to, there's a request to join, but it looks like I'm unable to do that. You can post a question and let me know what your question is, so that we can have a discussion. But actually, we're a few minutes towards coming to the close, so I want you to go on to the website, sign up for the e-newsletter, New Kidney Citizens, which is out. It's coming out again in the fall, and you also can sign up for new recipes. There's a great peach cobbler recipe that you may enjoy, and there are a wealth of information that you can obtain on there, that not just you but also your family members. So please pass the information on, and if there are no more questions, I'm just going to hang up. I'm going to hang on for a few more minutes and just tell you to enjoy, knowing that there's a holiday coming up. Make sure that you continue to keep up with your dialysis. Don't skip dialysis unless you really find that you're ill, because with a holiday coming, many people will not be going over their number of days, with the Monday being a holiday. So we want to be able to make sure that you're not gaining too much fluid during the holiday time. You got to be, especially if you have that extra day. If you dialyze on Saturday, you're okay. You're going to go till Tuesday will be your regular day. But if you dialyze on Friday, you will be skipping a day. You will go Saturday, Sunday, Monday. You'll have an extra day before you dialyze again. So be careful with your volume. Be careful with eating all those fruits, because remember, they're also liquid, and you do not want to put yourself into congestive heart failure if you're unable to handle all that volume. So that's also very important. So I hope you enjoy your weekend. If you're sitting out, be sure to put your sunblock on, wear a hat, wear long sleeves, so make sure you don't get burned, and especially you don't want to put yourself at risk. So take care, enjoy your weekend, and have a blessed time, and I will see you next month in June. So take care.